Asha Marihar, registered nurse practitioner, currently doing my MSc Nursing in Obstetrics and Gynecology here at STM University, Dharwad, Karnataka. Caring and nurturing motherhood is a blessing. We, as a nurses, should have complete knowledge to carry out safe and sound gestation. To do so, let us now know what is antenatal care. Antenatal care is a systemic supervision of both examination and advice given for a woman during pregnancy. It ideally begins before conception, extends throughout pregnancy until delivery. It lowers maternal morbidity rate, mortality rate, and increases perinatal outcome. History taking is an important aspect of health assessment which helps to assess present and past obstetrical, medical and surgical problems to detect risk factor for the patient and to her fetus. To understand better, let us now see how antenatal history taking is done. Wash your hands by using all steps of hand washing procedure. Greet your patient with smile. Introduce yourself to the patient to develop good idea. Obstetric history collection involves asking relevant questions to patient's current and previous pregnancy. Some of the questions are highly personal. Therefore, good communication skill and respectful manner are absolute essential. If necessary, provide privacy for the patient by screening. So let us begin with history collection. Namaste. Have a seat. Hello, I'm Asha Marihar. Today I'll be taking your health history. Is it okay with you?
Okay.
Can I know your name?
My name is Radhika Mishra.
How old are you, Mrs. Radhika?
I am 26 years old.
Which caste and religion do you belong to?
I belong to Hinduism.
Where do you live?
My native is Delhi, but since couple of years I am living in Gandhinagar, Dharwad.
Okay. How many years passed for your marriage?
I have completed 2 years now.
What is your qualification, Radhika?
I have completed my masters in BA.
What do you do for living?
I am a housewife.
What is your spouse occupation?
He is computer science engineer in IT company.
Oh, great. Is this your first pregnancy?
Yes.
Oh, congratulations, Ms. Radhika. Do you know how many months pregnant you are?
Yeah, I have completed 8 months.
Here, we wind up with biographical data summarizing as Mrs. Radhika, 26-year-old, married woman, belongs to Hindu religion, lives near Gandhinagar, Dharwad. She has completed her Masters in BA and is currently housewife. Her husband is an IT engineer. Mrs. Radhika is a primigravida with 32 plus weeks of gestation. Do you want me to add something in this?
No, ma'am.
Chain complaint should be taken in old card method, which elaborates O for onset, L for location, D for duration, C for characteristics, A for associated manifestation, R for radiation, and D for treatment. So may I know what brings you here today?
Ma'am, I am having back pain, lower back pain.
When did you start having this pain?
Since from 1 year when I was baby.
Where is the pain? Can you locate it for me?
Yeah, it is lower back pain and here.
How long does the pain usually exist?
It 10 to 15 minutes it will be.
What does the pain feel like?
It is like pricking pain, ma'am.
Have you noticed any other problem related to that?
No.
Okay. Does the pain radiate to other part of the body?
No, it is confined to lower back pain.
Have you tried anything to relieve the pain?
Then I usually lie down at one side and then gradually the pain will reduce.
Okay. History of present illness is a summarization of chief complaints, which goes on by Mrs. Radhika was apparently alright 1 week ago. Then she developed pricking pain in her lower back, which lasts for 10 to 15 minutes and was sudden in onset. There was no history of nausea or vomiting, no history of fever associated with the pain. Do you want me to add this?
No.
Further moving to past obstetric history. As my patient is a primary gravida, she doesn't have her past obstetric history. But for multigravida women, detailed history of past pregnancy and fetal outcome should be asked, which includes date and birth year of the child, pregnancy event, labor events, mode of delivery, puerperium, baby weight and sex, duration of breastfeeding, growth and development of the baby relevant to age is being attained or not. So let us now move to present pregnancy history. When did you have your last periods?
It is on 21st April 2020.
Do you know when is your expected date of delivery?
Yes, ma'am. It is on 28 January 2021.
Have you got registered in any PHC?
Yes, I have registered in Harvard PSC, ma'am.
Have you taken any vaccination in early pregnancy?
Yes, I have taken tetanus toxoid, 2 doses of it.
How many antenatal visits have you been?
I have completed 4 antenatal visits.
Oh, very good. Further moving on, I'll be taking your menstrual history. Is that okay for you?
Yeah.
At what age did you attain menarche?
13 years, ma'am.
Did you have regular menstrual periods?
Yes, ma'am.
Is your menstrual flow regular, severe or heavy?
No, it's regular.
For how many days do you have menstrual flow?
3 to 4 days.
Do you experience any pain during menstruation?
No, I didn't experience anything.
Do you take any measures to relieve pain?
No, ma'am, I don't.
So if you don't mind, may I know your socio-economic background?
Yes, ma'am.
What is your family income?
It's 30,000 per month.
It is important to know your medical history. So can you cooperate? Have you been hospitalized earlier?
No, ma'am.
Do you have any history of injuries, especially in your back or pelvis?
No, ma'am.
Have you been tested for hepatitis B, HIV, STDs before?
Yes, ma'am. And I have a report. It is negative.
Oh, great. Is there any history of anemia?
No, ma'am. There is no history of anemia.
Are you on any medication?
No, ma'am.
Do you have any medicine allergies?
No, ma'am. I don't have any allergy to the medicine.
Okay. Is there any history of blood transfusion? If yes, then any history of allergy related to blood transfusion?
No, ma'am. I have not undergone any surgery, so I am not having any blood transfusion history.
Okay. So now let us know about your family history. Do you belong to nuclear family or a joint family?
I belong to a nuclear family.
How many members are there in your family?
4 members.
Do you have any history of congenital or hereditary disease in your family?
No.
Anyone in your family had multiple pregnancy?
No.
So now let us formulate family tree on the basis of information given by Mrs. Radhika Mishra.
Mrs. Radhika belongs to a nuclear family consisting 4 members. Those are father-in-law, mother-in-law, client's husband and client.
So let us now know about your personal history.
Okay.
Do you have any allergies?
No, ma'am.
Do you have regular elimination pattern?
I have regular bladder movement, ma'am, but sometimes I face constipation.
Okay. Do you have any addiction to betel leaves or tobacco, alcohol or other substance?
No, ma'am.
So, to summarize this history collection, I conclude that Mrs. Radhika Mishra, 26-year-old, primary gravida with 32 weeks of gestation, came to the hospital with the chief complaints of lower back pain since 1 week, which was sudden in onset. Her expected date of delivery for present pregnancy is 28 January 2021 and has been registered in Harvard BNC. She has taken 2 doses of TT vaccine and has attended 4 antenatal visits. She attended her menarche at 13 years of age and has regular 3 to 4 days of menstrual flow without dysmenorrhea. She belongs to middle class family with monthly income of 30,000 per month. Her past medical history is insignificant and doesn't have any allergy history of blood transfusion. She belongs to a nuclear family, doesn't have any congenital, hereditary or heart diseases in her family. She prefers vegetarian dietary pattern and has adequate sleep. Her bladder movements are regular but sometimes faces constipation and doesn't have any abnormal addiction to food or non-food particle. So, this is how we can collect patient's health history by using proper techniques and good communication skills.